What are the symptoms of high blood pressure? High blood pressure, medically known as hypertension, is often referred to as the silent killer. This chilling nickname exists for a very specific reason. Most people with high blood pressure have no symptoms at all, even if their blood pressure readings reach dangerously high levels. You could live with hypertension for years without knowing it, all while the condition quietly damages your heart, blood vessels, kidneys, and other organs. Understanding the reality of these symptoms, or the lack thereof, is the first step in preventing life-threatening complications like heart attacks and strokes. The myth of obvious symptoms. Many people mistakenly believe that they will feel their blood pressure rising. There is a common misconception that hypertension causes frequent nervousness, sweating, difficulty sleeping, or facial flushing. In reality, for the vast majority of people, hypertension is asymptomatic. You cannot rely on how you feel to determine if your blood pressure is high. The only way to know for certain is to have it measured by a healthcare professional or using a validated home monitor. Symptoms of a hypertensive crisis. While chronic high blood pressure usually shows no signs, a sudden and severe spike in blood pressure, usually a reading of 180 over 120 millimeters or higher, can lead to a hypertensive crisis. This is a medical emergency that requires immediate attention. Symptoms of this state include severe headaches, often described as a pulsating pain that doesn't go away with standard painkillers, shortness of breath, difficulty breathing even while resting, nosebleeds, unexplained and heavy epistaxis, severe anxiety, a sudden sense of dread or intense agitation, chest pain, which may indicate heart distress, vision changes, blurred vision or sudden loss of clarity, confusion or seizures resulting from brain swelling or lack of oxygen. Why silent damage is dangerous. Because symptoms are rare, the damage often happens behind the scenes. Persistent high pressure against the artery walls causes them to lose elasticity and narrow. This can lead to aneurysms, weakened sections of arteries that can bulge and burst. Heart failure. The heart muscle thickens to pump against the high pressure, eventually weakening the pump. Kidney disease. Damage to the small vessels in the kidneys prevents them from filtering blood properly. Frequently asked questions, FAQ. Can high blood pressure cause dizziness? While dizziness is not a direct symptom of high blood pressure, it can be a side effect of some blood pressure medications. However, sudden dizziness or loss of coordination can be a warning sign of a stroke, for which hypertension is a leading risk factor. Is a pounding in my ears a sign of hypertension? Some people with very high blood pressure report a rhythmic thumping or whooshing sound in their ears, known as pulsatile tinnitus. If you experience this constantly, you should get your blood pressure checked. Does facial flushing mean my blood pressure is high? Facial flushing occurs when blood vessels in the face dilate. It can happen due to sun exposure, cold weather, spicy foods, or emotional stress. While it can occur while blood pressure is high, it is not a reliable diagnostic symptom. 4. How often should I check my blood pressure? If your blood pressure is normal, less than 120 over 80 millimeters, checking it once a year at a routine checkup is usually sufficient. However, if you are in the elevated or hypertensive range, your doctor may recommend checking it daily or weekly.